People are lining up to get tested and receive coronavirus treatments at Elmhurst Hospital in Queens, New York. NBC News correspondent Ron Allen joins us live from there now. Ron, you're in one of the hardest hit areas in New York City. Can you tell us what's happening where you're at?
Gotti, this is the hardest hit. This is the epicenter. This is the center of the epicenter. There were people lining up from 6 o'clock this morning until just an hour or so ago to get coronavirus tests. They stopped testing. They're going to resume it. We think unclear why they stopped. They might have run out of tests. The big problem here is capacity. The hospital is at 125% of capacity. And there was a report, and the city has confirmed that during a 24-hour period, 13 people died. That's just staggering. And it's the first time we've heard of that specific information from one specific hospital. There was also a doctor here who apparently was so frustrated by the situation that she released some videotape showing the conditions, showing an overcrowded emergency room, showing the lack of supplies, just small number of ventilators that we hear so much about. She even showed a picture of a truck container out back, a refrigeration container where they were preparing to and perhaps had already stored some of the deceased. Just a terrible situation here. Behind me, you can see these are ambulances from all over the city, from all over this community. And they have been going out constantly all day while we've been out here, back and forth, bringing back people. It's just been relentless. One representative of the drivers said that there had been some 6,500 calls for EMS in New York over the past day or so, which is more than happened here after September 11th, if you can believe that. So just a really, not just to this hospital, but around the city. So just a real dire situation. And of course, everything we hear from the governor, the mayor, and others suggests that we are still a couple of weeks away from the peak, from where this really gets to its worst, if that's even imaginable. Let me just read a statement that we just got from Mayor de Blasio about Elmhurst, because it's been such a big thing in the news all day. He says that it is the center of responding to this crisis. It's the #1 priority of our public hospital system. A public hospital. This is a neighborhood of low-income residents, a very diverse immigrant neighborhood. So this is the only place that these folks have to go to. They don't have doctors. They don't have health insurance and all that sort of stuff. The mayor says that we've moved 40 ventilators here to increase the capacity. The staff are giving their all to save every patient. To the men and women working in Elmhurst right now, your city sees you, your city thanks you, and more help is on the way. The end here, he also points out that the ICU here has been working at 3 times the normal number of ICU beds during the past couple of days, 3 times the number. And that's, of course, where those deaths likely occurred. Lastly, a plea to the federal government. Help immediately. Immediately is the only word in capital letters in this note that I'm reading. Immediately. And you know there's been this back and forth between the mayor and the governor and the federal government and the president and all that. And what has been consistently the word from here is that the situation here is unique. You know, New York City has half the country's cases, and Dr. Fauci said the other day that it's half the new cases as well, just in the city, and the numbers are rising. And so while there has been some relief, the governor now says that there is enough personal protective equipment in the system to supply the needs on a short-term basis, a week or so, across the city's hospitals, across the state's hospitals for that matter. The question might be getting what's needed where, distribution. That might be the problem, he said, if there are shortages in some places, but he's promised that. They're trying to increase the hospital capacity here, as you know, in an astounding way. They're trying to build a 1,000-bed hospital at a convention center. They're a 2,000-bed hospital there. They're talking about building more capacity at some college campuses. Here in Queens, they're talking about they want a local emergency hospital built perhaps in a place like Citi Field where the New York Mets play. That's how dire the situation is here, Gotti. Just really, really striking and really, really tragic. Gotti?
Wow. Ron, that video that you just showed of the line around that hospital says it all. It is terrifying. It is painful to see, and it's happening in slow motion in front of us. Thank you so much for being there for us, and please stay safe out there. And Rahima Ellis continues our reporting now. She is outside Bellevue Hospital in Manhattan, where drastic measures are being taken to handle the influx of coronavirus patients.
Scotty, here at Bellevue Hospital in Manhattan, they are literally in the process of building a makeshift morgue. You can see the tents that are coming up here. And on the other side of a green fence over there, there are 6 refrigerated trucks, container trucks, that would be used for containing the bodies of those who die from COVID-19. It's not being used now, as I point out. They're in the process of making it. And this would be a realization of their greatest fears, that New York would be overwhelmed with a number of cases, that they would not be able to contain them in the normal process, and they would have to have an overflow facility. And that's exactly what they're putting up here. What you see is a truck that's coming this way, and they are going to build a fence that will not only have a fence here, but they will put a roof over this in order to protect those workers and in order to protect everything that goes on there in the event that it's needed. That's what's happening here at Bellevue Hospital. Got it, back to you.
With more than 50,000 coronavirus cases in the U.S., doctors are on the front lines, and they are racing to keep up with the influx of patients, as we've been seeing. Dr. Alex Hakim is an ICU doctor at the Providence Little Company of Mary Torrance Medical Center in California. He joins us now live. Doctor, I don't know if you were able to see some of those images, but the things that we are seeing out of New York are staggering. I mean, you've got lines all around hospitals. They are building makeshift morgues. This is becoming crystallized for so many people across the country that have been hearing about it, going outside, seeing that everything is sunny, but yet these images now seem to be bringing home what we're all facing. Can you give us a sense of what you're seeing? Is it different here in Los Angeles?
Yeah, it's different in Los Angeles, but what people forget is how many people are still coming to the ICU with strokes, heart attacks, and bad infections. So not only is it COVID-19 that these ICUs are inundated with, so are all the run-of-the-mill things that we normally see every year.
And those run-of-the-mill things that you see every year, if you're waiting in line with a lot of people that are there for COVID-19 and you need some stitches, what is the possibility that you may end up going home with coronavirus?
Yeah, I mean, it's not just the resources that are taken up. There is the fear that even an asymptomatic person with a surgical emergency could be spreading this virus. And this virus is, from a healthcare provider perspective, we always have a constant state of fear that, this could infect us. It could have potentially life-threatening consequences to the physicians. So there is a lot of psychosocial dynamics that are going on, not just the logistics, but the psychosocial stuff that the healthcare providers are dealing with. It's hard to focus on what you have in front of you when there's always an ever-present danger ahead of you.
We've been hearing about these shortages of protective gear. What is it about your job in particular? Is there a particular moment that you're most at risk? I know that when you have a patient that might be exhibiting symptoms of COVID-19, obviously you want to take the protection, but is it just about that, or is it about mitigating all across the board?
Yeah, I mean, you obviously have to mitigate across the board because things can lay on surfaces for days, but probably the highest risk procedure, and it's not just ICU doctors like myself, or ER doctors or anesthesiologists, but also the respiratory therapists and critical care nurses and emergency nurses during intubation. So intubation is the process of putting a breathing tube down someone's throat for the dreaded consequence of respiratory failure, or ARDS, that we see in this syndrome. And for patients in that circumstance, a doctor has to look basically directly into the throat of an infected patient, and without proper protection could receive a very high viral load that has been proven lethal in other places in the world to healthcare providers.
Wow. So we're talking about intubation for ventilators. This is probably one of the most critical remedies for coronavirus, or treatments for coronavirus. And in order to do that, you were basically risking your health in staring down the mouth of the coronavirus. Is that right?
Absolutely. And I got to tell you, critical care doctors like myself, there's tens of thousands of us around the world. We're used to chaos. We're used to high intensity. We're used to high volumes and making difficult decisions and having to give difficult news to people. One thing that we really haven't experienced as a profession is feeling like we are in personal danger ourselves. And why all these mass donations and PPE conversations, protective gear, is so important.
Can you talk to us a little bit about the mental toll? I mean, how are you guys doing? How is the staff at the hospital talking about this? What gets you guys through it?
Yeah. So right now I'm quarantined, self-quarantined with my colleague. I haven't seen my kids for a couple of weeks, and they're both under the age of 2. I haven't seen my wife for 2 weeks, and a lot of the physicians and nurses at my hospital have to self-quarantine themselves, and so you're dealing with a global catastrophe, and then at the same time, some of us are having to deal with it by ourselves and with our fellow coworkers. Surprisingly, though, I have to tell you that the morale is very high. ICU doctors, ICU nurses, I think we've always prepared for moments like this. We've always talked about moments like this. Our hospital, Providence Little Company of Mary, we've actually planned for things like this, and I'm very pleased to say that people are really taking this seriously. And the social media has been really helpful. The news that we get from your station, as well as the direct reports from people that are entering it on Facebook and on Reddit and Instagram. Hearing that stuff weeks in advance has really allowed us to prepare.
And doctor, finally, how's your family doing? You just said that you have some kids at home and a wife, and you're separated from them. It's been a while since you've seen them. How's everybody doing in all this?
My kids are too young to realize what's going on, which is, really weird, because, every 2 weeks when you're this young, you add a new skill set, and you start saying words that you never said before. So it's just hard to miss moments like that. But, thanks to social media, we Skype together, we WhatsApp together, and I know it's not the same, but it's hard. It's been really difficult because my wife, in a time of crisis, that's when she would like for me to be there the most. So she's really sacrificing a lot for me and my career.
Gosh, doctor, thank you so very much. We are praying for the day that you can hug your family once again, and you are the very definition of a hero. So thank you for joining us.
Thank you very much. I appreciate the time.